am going to go ahead and introduce our speaker and topic. Y'all know this is developing partnerships, and we have a little bit different setup for this one, where 101 and 201 are being done by two different presenters, we have two presenters here today as well, but we have two different groups for 101 and 201. For 101, I'm so excited to get to introduce y'all to Dr. Kristen Clancy and Regina Johnson. They are from the Houston Recovery Initiative. If you have ever gone to the Houston ROSC meetings, you'll know a little bit about what they talk about, but they are here to share so much more, and I am very excited for their presentation.
I'm very happy to be here. Jesse and I have known each other for many, many years. And as somebody else who's a woman in recovery, it's always exciting to see how people grow and evolve over time. Even though she had to move to Austin to do it, that's okay. I understand completely. I'm in Houston still, but I'm in a better part of Houston. So I'm very happy to be in the Houston recovery, both personally and professionally, and being able to use my skills here in Houston and across the states. So we're going to introduce ourselves. So my name is Dr. Kristen Clancy. I am a pharmacist by training. I worked 10 years for nonprofit pharmacies, either the hospital setting or clinic setting, but I've worked over 25 years in the nonprofit world, both in public safety and public health. I have a doctorate of pharmacy from Texas A&M College of Pharmacy. I have a master's in healthcare administration from UT in the Valley, so it's not quite a UT school, but it's all right. I've been an EMT, a police dispatcher, a public health investigator, and an academic researcher, in addition to being a pharmacist and everything related to pharmacy. I started a nonprofit called RX Recovery at the beginning of the pandemic because I was seeing a lot of the stigma and healthcare providers preventing people from obtaining their medications if they had substance use or mental health issues. I had gone through that personally, and having come through the other side, I definitely did not want other people to have to go through that. So RX Recovery began as an initiative to work one-on-one with patients and with prescribers to help them get their medication. During that time, I started volunteering for the Houston Recovery Initiative, which we're going to learn more about in a minute. And I was the behavioral health integration work group chair for several years. That group was specifically to bring together people in the primary care setting, so physicians, dentists, pharmacists, and connect them with the treatment world, because they don't get any training on that unless it's from personal experience, right? And then we wanted to connect people in the treatment world back to primary care. And I'll use myself as an example. We're going to use a lot of our own personal stories for this presentation. When I was in treatment, I, threw a cavity or a crown or filling, whatever it was. And I needed, serious dental care. And I was at a really high-end facility, and they were not affiliated with a dentist. And I'm like, you're kidding, right? Like my insurance company is paying you $2,000 a day in addition to the money that I'm paying you, and you don't have a way to connect me with a dentist. And you're gonna risk losing me as a patient, but two, I'm gonna risk losing my life because you weren't prepared. Like, we can't have this. So based on that experience, I really enjoyed connecting with both sides of the line, basically, and finding out not only what their successes were, but also their challenges, the barriers, and how we could work together to resolve those things. If anybody's an Aggie fan, I did get a Fight and Text Aggie Outstanding Alumni Award recently. Unfortunately, I was supposed to get it the day that the storms blew through Houston, and so instead of getting an award, I got two trees and a power line go through my house. It's pretty exciting. Just to know a little bit, like I grabbed that power line and threw it over the fence. Yes, I knew there was no electricity running through it, but like that's the kind of people I love working with in the recovery world. So I will have 10 years of recovery in November, and it's technically not, I'm not touching a chip. It's not real, so I'm not jinxing myself, but I'm really excited to have spent this much time in the rooms that I can bring those skills to my professional side.
That's me. That's me. Hello, everybody. I am Regina Johnson, and you know, I talk a lot, but ad-libbing, talking a lot. So when Dr. Clancy said, "Hey, we have to present this," you know, Jesse asked us to present, and we're going to do this, and I said, "You mean like formalize, like actually put something together and speak to people?" I'm not sure about that. But here I am. So I am Regina Johnson. I am the program manager for Houston Recovery Initiative, and doing this work for 5 years. I think it's been 5 years now. And so I don't come with all of the experience that Dr. Clancy comes with in the recovery community. But in those 5 years, I have been afforded the opportunity to gain my community health worker certification and to become an RSPS. So those two things work hand in hand, and they are beautiful together, and they help me in the work that we're doing here. I am honored to say that I'm an ally of recovery. I have always been for a while in the nonprofit world, but not in the recovery community. When I entered the recovery community world, I realized that I had a voice for it, I had passion for it, and it just became something that I wanted to advocate for. So I've been in it and just kind of loving it here and loving what I'm doing. Okay, so we're going to talk about a ROSC and talk about Houston Recovery Initiative altogether. I first want to say that I know previously you guys heard from Dylan West, I mean, not Dylan West, but you heard from Dorothy West. You heard from Joe Powell. You saw pictures of the Philander Moore and sitting on the steps of Austin at the Capitol and things like that. So that has been one of the great things in this work that I'm doing, because I have had the opportunity to work with all of them. Dylan and Dorothy were the first ones that kind of grabbed me in and said, "Hey, we're doing this work." And so it kind of made me fall in love with it. Also working under Leonard Kincaid, who is a pioneer himself. So working with all of these pioneers has been pretty awesome. And then now for the past, how long has it been, Kristen? 2-3 years working with Kristen. Yeah, just doing more work.
Different roles.
Yeah, different roles. Yeah.
Can't get rid of me.
But it's been great though. So how many people have heard of a ROSC, and do you know what a ROSC is? Yes, Chris knows. Kristen knows. Shanna knows. Those are the people who I see on my screen. Okay, Mike knows. Janet, I know you know. Another one of these things is being in the community. You see names and you see faces and you're like, I've worked with these people before. I know them on different projects. So another thing we'll talk about further down of partnering and with different organizations. But as you see here, a ROSC is a recovery-oriented systems of care. So William White is the founding creator of the ROSC model, defines it as a coordinated network of community-based services and supports. It's person-centered, builds on strength and resiliences of individuals, families, and communities to achieve abstinence and improved health, wellness, and quality of life. So the key components and principles of a ROSC, and I'm talking about this because Houston Recovery Initiative, when I mention it further, I'll say HRI. That's the Houston Recovery Initiative. That is our organization, and it is a ROSC. We are the Houston ROSC, the largest ROSC in the state of Texas. So some key components and principles of a ROSC. It is person-centered care. It's a continuum of care, community integration, recovery-oriented services, peer support, collaboration and coordination, and cultural competence and equity. Hold on, I'm trying to move this, Kristen, so I can see. Okay, so the Houston Recovery Initiative was founded in 2010. It's a volunteer organization. We are, besides Kristen and I, and a couple of more that since Kristen has come on, that she's brought on part-time help for us, like outreach coordinator, things of that nature. But Kristen and I, before Kristen and I, it was a totally volunteer ran organization. Kristen and I came on board, and we are paid staff, but we are still doing the work through our volunteers. We create opportunities to collaborate with agencies across Houston. Our work is done again by those volunteers, and it's done by work groups. We started with 8 work groups. We now have 17 work groups. How do we do it? I don't know. We still don't know. We're still learning. We're still growing, and it's still a process, but we have 17 work groups. A little bit about the work that we do. HRI identifies existing resources and publicizes them, educates and enlists community stakeholders to join in its work, orchestrates collaborations and partnerships. We do the work again with our work groups. Each work group determines the needs of the community within their domain. Okay, so we have, Kristen, can you go to the next slide? So within the HRI, this is a list of some of all of our work groups. To highlight a few, there's the adolescent ROSC, which is probably one of our most active work groups. We have behavioral health, which is actually led by Kristen. We have the faith-based recovery, families in recovery, recovery housing, which is a very active work group. Law enforcement, I'm going to do that one last because we're going to have, Kristen's going to make a little comment on that one. We have our overdose awareness and opioid, our peers. So all of these work groups focus on their expertise, and then they do the work. It's amazing how it all comes together. Pre-pandemic, we met we still meet every month. We meet once a month, every third Friday of the month. Within that meeting, we do networking. We collaborate. We have speakers. We share resources. Pre-pandemic, we met in person every month. So it was an opportunity to be face-to-face. It was an opportunity to hug. It was an opportunity to, just show that face-to-face support. The pandemic happened, and we're still trying to recover from that, with membership, with, participation and things like that, but we're getting there. We went virtual. It gave us the opportunity to actually host the first Big Texas Rally virtually. That's when I first started working with Joe Powell. We chaired and co-chaired the first virtual Big Texas Rally, which was amazing. since after post-pandemic, we are still virtual. We try to have a in-person meeting quarterly. But right now, for the most part, we are still virtual and just still trying to gain that momentum back for everybody. You know, I think everybody enjoys Zoom, but then you get, you know, we're tired of Zoom, and so it's kind of what and what. Like we love it. We don't want to drive, but we do want to see you, but we don't want to. How do we get there? So we're still kind of trying to fight with that on what's best on how we're gonna meet, but we're doing it. So that's a little bit about ROSC, and that's a little bit about the HRI. Does anybody have any questions about that?
I see Janet has her hand raised.
Okay, Janet, I'm sorry, I can't see the people, that's why. Go ahead, Janet. Hi, Janet.
You're still
You're
muted,
still on
Janet.
mute.
There we go. Can you hear me now?
I hear you.
Okay. So I used to attend the ROSC in Austin, but I haven't found that most of the ROSC do not like mental health organizations coming in, or when your focus is mainly mental health and not substance use. And I think that yours does, if I remember right, when I reached out, because we have a group, we have a prosumer group in Houston. In fact, I just onboarded a new employee today in the Houston area. But what does it take for people that run mental health organizations to be able to get into the ROSC and be welcome? How can you? Because I've never been able or invited for one in San Antonio.
Okay, so first, what we can do is, so in our meetings, one of the things that we say is that our chat box is our best friend when we're having our meetings. That's where so much information is shared, contact information, resources, job opportunities, just everything is left in the chat box. We call it our best friends in our HRI meeting. So I can add you to that. I would love to add you so you can get invited to our HRI meeting, first of all. So if you can share that, I will gladly get your information and add you to the list. I promise not to bombard you, but we will add you to our list. Kristen, you want to speak on, because mental health, yes, that is actually one of our work groups. And one of the things that we're most proud of, if you look at the list, the areas of interest, and you see new at the bottom, the 4 new at the bottom, those work groups are added because of the community, because they asked for those things, because these are, when we first started, we had our work groups and it was based on, surveys that we put out there, going to talk to community, and these are the things that were needed. As we've grown, we've learned that it has expanded, and there are other things that people need. And so these are at request: the BIPOC, the LGBTQ, the women's, the veterans, those were asked. And so here we are. Here we are helping the community. That's what we do. Kristen, you want to talk more on the mental health piece?
Yeah, so we actually have we have several people from NAMI Greater Houston and NAMI Central Texas that attend. Many of the treatment facilities that attend also treat mental health and substance use disorder. I would say that honestly, there's so much crossover. It is really doing a disservice to our clients if we're saying, oh, we only do one or the other. I think we really do both. I can understand that resources being limited, maybe the focus should only be, certain topics for meetings, but everybody should be invited.
Yeah,
and nobody should
and
feel
NAMI,
like they're not welcome.
Yeah, NAMI is more of a parents group, but we're a COSP, a consumer operated service. We're trying to get that changed to POSP, a peer operated service provider. But we haven't found in most of the ROSC, we serve 4 areas in Texas, and we have not found ourselves been welcomed to most of those ROSCs. So
So we can have a conversation about this offline, but I would say much like Regina described, ROSCs in any coalition, they go through seasons of participation and activity. And I know, for example, the Austin ROSC kind of has been, working behind the scenes for a year or so, but they haven't been, super active. And I was really disappointed when they dropped off, because I wanted to attend those meetings during the pandemic when everything was happening. So let's talk about it offline, but if something happens and then 6 months later something else happens, like, it wouldn't surprise me. We are supposed to have a consistent message, and we're going to talk about that too. And so I can't answer your question without having more information, but I definitely want to talk about it more. Before we leave this slide, I did want to talk about the law enforcement piece. So I have, my background was in harm reduction, right? So, or in Texas Recovery Support Services, however you want to soften the edges around it so it's accepted. And I worked with several organizations who would not conduct a meeting, like you were saying, Janet, if law enforcement was in the room. And it's like, okay, you kind of need them to be at the table, and you need to have them have buy-in to what you're proposing, and they need to understand you better and why you're asking for certain things. So I think the CDC created this logo, and they put it at the bottom right next to the civic, in the heart. Like, just think on that a little bit. If that's something that your organization thinks or believes, or you encounter an organization like that, we're not gonna recover as a community if everyone in the community is not there, and that includes law enforcement or any first responders. So I'm going to go over the agenda quickly. We did the introduction, meet the speakers. We talked about what HRI is, what a ROSC is, and the history of the ROSC. Regina's going to talk about leveraging partnerships, and then we're going to learn about you, kind people, to find out who you are, why you're here, and how we can learn from each other in this presentation. We're going to talk about how to be a good partner but maintain your own identity, partnering with organizations that we may not think of as partners, avoiding duplication, and we'll talk about more of what that means. Navigating risk and purpose alignment, how to align with partners that want to do a share of the work, not just people that align because they want you to do all the work. And how to navigate boundaries so you don't change your mission or change your activities just to pursue funds. And then we'll have some final thoughts. And if you have any questions, just put your hand up and it'll pop to the top of my screen and I'll call on you.
Yes, because I can't see it, so. Okay. Leveraging partnerships to build a stronger and more effective recovery community. So this is good. Enhancing collaboration. So HRI, we are forever networking. Forever networking. I can't tell you how many emails I get a day from Kristen, and it'll just be, some event that's going on, or here's a flyer, or here's this, or here's that, because we need to be in attendance to put the organization out there. Kristen and I are the face of the organization, so trying to be places and representing HRI is big for us. Our coalition meetings are set up to do just that. One of our meetings is we have 3 different types of meetings. We have a speaker meeting. We have a work group where all the chairs of the work group kind of tell you what their work group does, what they're working on, their mission, their goals, and where they are in the community, and if you want to be a part of it, let us know. And then we also have a networking meeting, which we call it our 60-second commercial, We give every organization 60 seconds to come on the mic and what do you do? Who are you? All of those things. And that's an excellent opportunity for networking and being able to share resources. Again, that chat box, best friend. Resources are shared, relationships are built, collaborations start. It allows, as the slide says, allows professionals to connect, share resources, collaborate effectively, pool in your expertise. We partner with universities. They have access to tools and data that we need that, you know, we wouldn't be able to get. We partner with mom and parent groups, you know, they can reach a level of the community that we may not have access to. And again, as Kristen talked about the law enforcement, that is so vital to have them at the table. You need them on your side. Don't be afraid to invite people to the table for the exact reason that you need them. Kristen has a way of asking for exactly what she wants and exactly what HRI needs, and is not afraid to do so. You know, the answer is yes or no. But we have something unique to offer, and we realize that in everything that we do. Just like if, you know, we have organizations that, you know, you may be, let's say you're applying for a grant. The grant may not totally fit what we do, but if there's a piece in there that we do, or one of our work group does as a part of this organization, then leverage that. Find a way to place yourself in there to share resources and to collaborate with that organization. Make it happen. Some of the other things, Kristen, you can go to the next slide because I'm talking about technology. That's really big for us right now, because we're trying to, new email system, you know, is what we're trying to do that. We're trying to do new reporting systems, you know, grant tracking, these things, but leveraging your partnerships for again, for those things that you need is important. So knowing who you're talking to and knowing what they have, you know, just yesterday we're talking to somebody and we're talking about what we need. We need to report this, or we need to be able to do this, and we want to sign up for, but it costs too much. You know, we can't, we don't know what to do. Oh, we have a subscription. Oh, you do? Okay. You know, and saying, okay, can we use it? Because we've already researched it. So we already know that if you have it, you can give us, we can have a login, and then we can have our own little section on this thing as well. So, you know, knowing what you need and not being afraid to ask for exactly what you need with the relationships that you have with other organizations, or with partnerships with other organizations. I think now with one of our grants, it's specific to Spring Branch area. That goes back to the, you know, partnering with mom and parent groups and being able to have access to youth that Kristen and I wouldn't be able to have access to that. So you find people that are in your community, find people that are in your ROSC that, you know, we'll put out a call to action. And, you know, we need people that are in this area that are, you know, doing this, and see who answers the calls, and then reaching out to those people. And this is what we need in order to, you know, get the information. So again, I say it because it's so important, and not being afraid to ask for exactly what you need.
All right, fantastic. So in order for us to most appropriately tailor this organization, we want to hear who we're talking to. So what I would like to do is go down the row of who I have on my screen. And if everybody can give me just a 1 minute who you are, where you work for, and where you are, and what is one thing you want to learn from class today. I would appreciate it. And we're going to start with Jessie.
And how you doing?
Oh, and how you doing?
So tell me again what exactly you wanted, because there were a
Who
few
you
things in there.
are, where you are, who you work for, how you doing, and what do you want to take away from today? Just one thing.
All right, that's a lot. While I'm sharing, could you type that in the chat for
Yeah.
other folks? I'm Jessie Davis. I'm a peer supporter, and I am currently living in Mattoon, Illinois. Moved out there literally a year ago, and it's been great. I work for the University of Texas at Austin, and I get to do POGA and also work on the MHTTC grant that we have, which is awesome, and I get to work with folks to provide TA and consulting. Oops. What else? How I'm doing? I'm doing great. What else?
That was it. Okay.
Woo!
And I typed it, and apparently it doesn't like it when I use my arrow keys. Okay. Janet.
Okay, my name is Janet Paleo. I am the Chief Financial Officer, founder, and other such of Prosumers International. Anna Gray is our Executive Director, and we have 4 sites in Texas. I'm in the San Antonio site, but we also serve the Valley bilingually, Houston and Plano. Glad to be part of this. What I want to get out of this one is really looking at the collaborations and the, how we do certain things. We definitely want to partner with people. We do believe in that makes us all stronger. When peers work with peers, whether it be on the substance use side or the mental health side, it does feel like a lot of, especially, I know a lot of people that are in this cohort more work with substance use, and it feels like sometimes it's hard for us to have a voice. But we're doing our best, I think, and trying to hold her on. But that's the only thing. So I hope that helps.
Thanks you. Appreciate it. Chris Bailey, in 1 minute or less, all those questions.
Hey, so I'm Chris Bailey. I'm a project coordinator with an FQHC out of El Paso, Texas, called Project Vida. We're embedded within a few different service structures in the area, and we serve 5 different areas in our community, as well as rural parts of El Paso County, Hudspeth, and Culberson. We are also embedded in residential recovery services with our area partner, Recovery Alliance of El Paso. Shout out to JC. And I'm also a convener and a consultant. I do consultant work nationally. So I'm a convener for our local ROSC. We do a lot of work, and what I hope to get out is actually of this is not just what we do within our local ROSCs, but how we network the rest of the state and create a red thread message for the recovery movement in Texas. We had that with the Texas Recovery Initiative. It's kind of fallen off a little bit and kind of moved, I think, in terms of its mission with the group. But I would love to be able to. I am a subscriber to your all's listserv, so I do get emails from the Houston Recovery Initiative, and I'm really always pleased to see the work that y'all are doing out there.
Well,
That's awesome, Chris. Chris, do you guys have meetings for your ROSC?
Oh yeah, we meet once a month with each other. We have really vibrant work groups. We have about 12 different work groups right now. Our most active one right now is the El Paso Harm Reduction Alliance, which was we treat our ROSC as an incubator for different coalitions and work at getting them started and set up, do a lot of backbone support, and they've been incredible. So we have an adolescent work group, we have an education work group, peer concentration work group. So we do a lot of trainings for our area peers and enhancing their skill sets. We also do work and outreach with our behavioral health communities. So we do a lot of work with the BH side. It's been a struggle just because there's a lot of siloing in our behavioral health community. But when we find a willing partner, we get them a seat at the table and get them working.
Awesome. Thank you.
Yes, siloing is something I think that we always are trying to overcome, no matter what side we're working on. Shanna, or is it Shayna Anderson?
Hey, Shana, you said it right. Thank you
Okay.
so much. Yep, my name is Shana Anderson. I'm an RSPS with Unity Recovery. We are located in Weatherford, Texas. That's just right outside of Fort Worth. I'm doing wonderful. Thanks for asking. One thing I want to learn today is partnerships and collaboration. Those are easy to do, right? Like you can meet with someone and learn about what that person's doing, but to maintain that collaboration and partnership seems to be something that I struggle with. So it's kind of like sometimes out of sight, out of mind for me. And if I'm not staying on top of that, then I'm not fostering that relationship. So I would like to hear about how y'all do that.
Yes.
Yeah.
I will tell you this, and if I don't give you more answers before the end, ask me again. But I go to a lot of meetings. I go to a lot of people's meetings. I see the same people over and over again. And if I don't call them or email them or whatever during the month, I'm still going to see them at that meeting.
Yeah.
Right. And to me, I'm kind of cheating by doing that. But that's how I got to be well known in the Houston community professionally, was because I was just so willing to show up to each of the different other organizations that were putting on meetings. So I would say that's the cheating way to do that. But yeah.
Thank you.
Thank you. Julie Early.
Hello, yeah, I'm Julie Early. I work at the Texas Institute for Excellence in Mental Health. I'm a research associate, social worker by schooling. I work with Jesse, kind of helping the gears turn for the peer organization Growth Academy here. And I'm also kind of have a dual role. I'm also the kind of our evaluator for this. So how am I doing? I'm pretty awesome today, and what I hope to learn is what everyone wants to learn.
Fantastic. Arza Demi, did I say that correctly?
Yes, you did. Hi.
Hello.
My name is Arza Demi. I work for Communities for Recovery. I'm a center and volunteer programs manager. I'm doing great. Thank you. I'm here to learn and just, to listen. What did I answer everything?
Where are you located?
Oh, I'm in Austin, Texas.
Okay.
Mhm.
Thank
And
you.
I was once at the ROSC in Houston, and you guys really do an amazing job.
Oh, thank you.
It is a different level.
I hear that too.
Yeah.
Thank you. Juan Carlos.
Hi, everybody. My name is Juan Carlos. I'm a project coordinator here for Recovery Alliance. We have two drop-in centers. Project coordinator for the one in the northeast of El Paso, Texas, called Sanaremos. So we do outreach here. We give out harm reduction supplies. We also do some in-reach. We go in the jails, show support to our peers that way. Yeah, so just glad to be here. I'm doing great. Willing to learn whatever you have to offer. I think I already learned something, which is to go to meetings and get to meet these community partners.
Yes. And usually they have food. Like, it's just food. Just go. Stormy.
Juan Carlos, are you with Ben Bass?
That's correct. Yeah, that's my boss.
Yes.
And we work closely with Project Vida, which is Chris Bailey. So yeah.
Okay. I worked with Ben on the first couple of Big Texas recovery rallies.
Nice. Yeah. That's cool.
Yeah, and Prosumers actually has an MOU with your organization.
Oh,
Look at that.
see?
See?
Now
Networking
we're
at its finest.
exactly. How about Stormy?
Hi, my name is Stormy. I am located in Denton, Texas. I am here for Texas Family Voice Network. Let's see, what do we need? Who, what, when, where? I'm actually doing really well today. And today I hope to learn how to sustain community partners and things like that. Just, have them to kind of join the board, the membership of the group and just of our organization and just kind of maintain them.
Okay, awesome. Great. I love Denton.
Thank you.
My parents used to live in Gainesville, and I would have to drive from Austin to Gainesville, and I'd get to Denton and just be like, I'm done. Like
Yeah.
they need to move.
I'm relatively new here. My daughter, well, I can't say that. My daughter came to college here at UNT several years ago, and she stayed. So eventually we all just kind of moved up here to Denton.
Very cool.
Thank you.
Enjoy. Mike Duguid.
Hello, my name is Mike Duguid from Houston, Texas. I work with Credible Messengers United. We deal with juvenile kids who have been justice involved here in Houston. Let me see where. What I want to learn today is, I guess, pretty much how to network.
Oh, good.
Mike, you guys came to, I don't know if you in particular, but your organization.
I did. I
You
did. It was
You
me.
did. Okay. I remember your
I was
organization.
at the ROSC. Yeah, I was
Yeah.
there. I
Yeah.
was there.
Okay, cool.
Okay.
Have you come back since?
No, I haven't been back. I haven't been back.
Okay.
Okay,
Let's work on that.
put in the chat what we need to do to get you back. What did we do to lose you, and what do we need to do to get you back?
Pamela Bryant.
Okay, hello, my name is Pamela Bryant. That's what my name is for today. I'm with Walking by Faith Prison Ministry. I'm the founder and director. And what we do, we're part of being part of the solution and dropping the recidivism rate in the formerly incarcerated and unhoused community here in Austin, Texas. We are a peer-driven organization. Y'all hear my grandson? I have grandchildren. That's how I'm doing. They're out. Dog, yeah, dog. Look at them. Okay, tell them. Okay, I'm just letting y'all see what I'm going through. I also cook for the unhoused community. So we have plates. I'm making barbecue wings, potato salad, green beans. I also am the founder of Pam's Way Kitchen. And I build relationships in the woods and in the community by food, peach cobbler, and home cooked food. And so
With food.
I do it through
I'm telling
food.
you. You guys already know everything that I was going to teach. It's just food.
It's through food. And so what I would like to learn, I would like to just build, I liked it when the lady was speaking, I was trying to listen, I had the best thank you for the peach cobbler. Yeah, it gets to people's heart. I was thinking about when she said, like building partnership and with the community. And I like doing that. So, and I want to get back more involved. So that's what I want to learn. Like, hey, it's that season. It's time to get back out there. And yeah. So thank y'all for letting me share.
Thank you. And Regina Askew.
Okay. Hi. Okay, I'm late getting on, so I'm not really quite sure what we're discussing.
Oh, let me paste it again. So we're just doing intros. So in 1 minute, who you are, where you are, what organization, how are you doing, and what do you want to learn?
Well, you all look familiar.
You look
Right.
familiar.
So I'm Regina Askew, and I'm with Strategic Recovery Solutions here in Houston. And I try to make as many ROS platforms as I can. A lot of times I want to get in a little different organization, but it's always a conflict, you know. I'm gonna make it though. I'm trying to find, you know, 'cause there's several like the housing and children, the youth, and there's several that I would like to get involved with. But okay, so I'm with Strategic Recovery Solutions. I'm the director of programs. I'm a RSPS and an MHPS, among other things, CHW, and it's a whole slew. And what was the other thing?
How you doing?
What was the other piece?
How you doing?
Oh, honestly, I'm doing better today, but I've been challenged the last couple of weeks. You know, but you know, I'm just putting one foot in front of the other. So this is all my little disguise to kind of hide all that stuff. So, but I know how to show up, you know.
Sending you positive energy.
Yes, thank you.
Thank
Yes.
you.
Thank you.
And did I miss anybody? No. All right. Oh. Okay.
Did Adriana go?
Oh,
Adriana, I don't think so. No.
hi Adriana. We're just doing intros. So in 1 minute, who you are, where you are, what organization, how you doing, and one thing you want to learn.
So my name is Adriana. I work for Prosumers International. I'm the office manager and just recently did my MHPS training, so working towards getting those hours. And I'm just trying to learn anything that's going to help me in the role of peer support specialist, but also in leadership role. And that's pretty much it. And I'm okay, overwhelmed and tired, but what do we do, right? We keep going.
Fine. All right. Well, good. I'm glad to know everybody just a little bit more. So we're gonna move on to learning how to maintain your own identity and maintaining fidelity to your mission, but then also how to partner. So when you were starting your organization, one thing I love hearing, and it breaks my heart at the same time, is I want to start a nonprofit. And it's like, okay, what do you want to do? And they don't know, they just want to start a nonprofit. And that, you know, for people that are really young, if they're in school, if they're doing a change in careers, something that tells me like, hey, they're new to the world and they're trying to figure out where they fit, that's great. But I don't think anybody in the nonprofit world would say like, oh, you should start a nonprofit just to start a nonprofit, because it's really hard, right? And number two, like, none of us are here to make $1 million and retire early and, you know, go to the tropical islands. Like, we see a huge need in our communities, or we've had something happen to ourselves. We know there are gaps in services, and we want to help individuals so they don't fall through the gaps, right? Whether it happened to us or it happened to a family member, whatever the motivating factor is, the exposure is really necessary, because the first few years of being an entrepreneur are very stressful and very painful, and in the nonprofit world, financially, it's going to be even worse, right? Because there's just not a lot of funds available for nonprofits, so we are sort of competing. So when somebody tells me that they want to work or want to have a non-profit organization, I always ask them why, and I always ask them, have they spent time with another nonprofit first? Because when you have worked with or volunteered with another organization, you can learn a lot of new things, which can be what you want to do, but can also be what you don't want to do or what you don't want to repeat for your organization. But when you are deciding that you want to partner with other organizations, you have to figure out who your organization is, who you are within that organization, and you have to write it down. And I know that is, now with the, AI, like we can get AI to write an elevator pitch for our website, right? Like we have easier ways of doing things. But if you don't write down your mission, your core values, and your broad goals or your measurable objectives, you won't be able to meet them, number one. And number two, organizations that are looking to partner with you, they don't know who you are either. And so you may seem like a less likely candidate for them to partner with if they're not able to easily understand who you are as an organization. So I always highly encourage people, if you need to write it down, and it needs to be in the format that is not notes on a napkin, but good enough to be at least a Word document. You don't have to be an expert at web design, but if you can write a Word document and include that information, that's really, really key, because when you are applying for grants, when you are meeting with individuals and we have a go around, just like we did, 1 minute, who are you? Bam. When you are in a nonprofit organization, you're going to get asked that at every single meeting. Who you are, what do you do? And if you guys didn't feel too comfortable with sharing that background, it's going to get even harder to share your elevator pitch or your core value or your mission statement, right? But you have to have that written down. Highly encourage you to put that online. When you find an organization or an individual and you're like, they seem pretty cool, or they align with what I'm trying to do here in Houston or here in El Paso, you need to do research on them also. I love LinkedIn. It's like the Facebook for professionals, but you can also learn about people and organizations just through their, they may have a Facebook page, right? If they don't have a website, they may have a website. They may have an organization like the ROSC, who has subpages. We're going to develop subpages for our worker leaders so that they can have a website if they don't have a website. But what is their elevator pitch? Can anybody tell me what an elevator pitch is? I'm going to tell you, Pamela was closest to it with her. Oh, and she's gone.
Isn't it like just kind of like a little 5 to 10 minute pitch about like what your organization does and information about the organization?
So you're very close. So think about it. It's called an elevator pitch because you have to get all that information out from an elevator ride. That's it. If you walk into an elevator and there's a mega millionaire and he gives away money, like you need to say, oh, hey, my name's Dr. Kristen Clancy. I'm the director of the Houston Recovery Initiative, which is the largest recovery focused coalition in the state of Texas. And boom. And then judging by their reaction, right? Maybe I can do a little bit longer conversation. Maybe I can share what our work groups are. That tends to be, for me, the next thing that I do is say that we have 17 work groups, and each are focused on a different facet of recovery. Things that people need to survive as human beings. People in recovery need also. So housing, healthcare, employment, and then I'll go into my talk if I have more time, right? Always really important. to learn how to, so one, memorize who you are, and two, learn to read other people, because you don't want to deliver an elevator pitch to somebody that's like, oh, you know, I hate people in recovery. I hate people who use substances. People that have mental health issues are just weak or whatever, you know, like, don't waste your time, your energy on somebody that, you know, you're not going to convince anybody of anything in the first 2 minutes of interacting with them. But it's good practice. I can't say I've had, like, as Regina was saying, I'm not afraid to say anything, so I have sometimes practice on people that I know didn't want to talk to me, but that's fine. So when you are, again, so a partner organization, when they're looking at you, have you clearly listed out a very short explanation of your organization? Do you have your mission statement? Do you have your core values, what your goals are, your 1, 3, and 5 year at a minimum, right? If not a 10-year goal, and then measurable objectives. And then after you meet an organization and you have all of your stuff put down, look at how you guys fit together. Like, what are your shared values? What are gaps that one organization can fill for the other? Is there the opportunity for collaboration, even if it's flexible? If you don't know how you guys fit yet, but you both know that you are going to be at an event later, can you host an after hours get together? Can you have a booth next to each other so you can spend more time chatting? Can you learn more about each other? And then you may find you have complementary missions, and maybe your mission is just, oh, you know, there's not enough employment training opportunities in our area, so people that are coming out, you know, out of jail, out of prison, after recovery from mental health or substance use disorders, like, how are they going to learn to re-assimilate into society if we can't teach them how to get a job? Like, maybe you just both recognize the same gap and you want to work together. Let that be the beginning of your conversation. I would never just say, oh, well, we can't figure it out, so I guess we're not going to collaborate. Like I was saying, like, I see the same people over and over again at different meetings across Houston and across the state. I tend to, again, my networking key, if anybody's ever seen me before, they know anytime I go to a conference, I have my hair down and I have a green shirt on, right? That's like my brand. If you have a favorite color that's like hot pink, you know, always wear it when you are at meetings or at conferences, and people will see you a lot of times and they will remember you, even if it's just that they've seen you in a green shirt before. I'm okay with that too. That helps people feel more confident in talking to me, that somewhere in there we've seen each other before, and you know, very likely it was at a networking event. If you do decide that you do want to partner with each other, it needs to be mutually beneficial. And several of you mentioned, you know, I just have a hard time with keeping up with that throughout, you know, throughout a year or so. It does need to be mutually beneficial, right? Like, it has to fit with my work schedule and needs and everything, just like it has to fit with theirs, right? And if not, you know, me personally, my organization and as a whole, like, sometimes it's just not the right season to fit, but always be super cool with people that you meet, because you never know when you're going to meet them later. And also have mutual accountability. If you say you're going to do an event or host a meeting with somebody, you know, show up and show out. I don't try to don't try to get out of it and just say, oh, I'm not going to see this person again. I'm not worried about it. We do really want to maintain, especially in the recovery world, it's so small. We do want to maintain connections with people. Everybody in recovery knows everybody else in recovery. They're all going to change jobs one day. They'll probably end up working in another organization that you work with. Like, try your best to do your best all the time. And hopefully they will do that for you. I talked a lot. I wonder if Regina is still here. I know she's...
Yes, I'm here.
Okay.
Yes, I am here. Okay, so partnering with organizations we may not usually think of as partners. Yeah, so we have some partnerships with that don't look like something that a recovery organization would partner with. But again, first of all, two heads are better than one. If there's an organization out there that's doing something that you feel like you can be a part of or that can help you, don't be afraid. Look for those partners in the not so obvious rooms. In our case, we look for passionate people that care about saving lives in the community, and just how we can win together. When you collaborate with different organizations, you foster trust. It increases your visibility in the organization, which you can attract more donors, you can attract more volunteers, which is what we're always looking for. Both of those things. And again, being clear about your expectations and your needs. Some of the things, again, with our putting out our call to action, we are asking, in conversations when Kristen and I are talking, she'll have this bright idea like, hey, let's do this. And then who can we talk to? Who does this? Or do you know the director of this organization? Do you know this person? And then I'm on Google and we're on a search, we're trying to find it out and hey, got it. Let's do it. So that's kind of like how we move behind the scenes. So everybody that's on here that's saying, hey, yes, I've been to an HRI meeting and it was great. And you guys are doing wonderful things. We really appreciate you, because behind the scenes, we're like, yeah, let's do it. And we're like, what are we doing? But when we present it to you, it's beautiful. It's a beautiful thing. But Kristen has put some of the things on the screens, or some of the organizations that we have powered with. So, and I'm going to read it out to you because I don't have it by memory, but the Girls Empowerment Network, that's an organization that I volunteer with on a personal level. And I've been volunteering with them for years before the pandemic, and this year was the first year that they've been back to Houston in person. They do an annual conference for girls. So they have girls third through 12th grade discover they are powerful. They do it in Central Texas, Houston, and Dallas. They're actually based in Austin. They do it by teaching self-efficacy, which is a girl's belief in her ability to succeed. And so this year, again, was the first year that they came back to Houston in person to have the conference. And we were just talking about at HRI, we were having a meeting. It was our month to have our speaker meeting. So we were like, who are we going to get to speak? And one of the ladies who is the, I forgot Brittany's title. She's director of something. I forgot her title, but I reached out to her and asked her if she could be a speaker for our meeting. Now, this organization is not in the recovery field. There's nothing on their website that says anything about recovery. So there's no indication that she would want to partner with us, or she would want to do anything, with Houston Recovery initiative. Why would she? And why would we want her to? But then when you think about the kids, and then you think about the help that they need, you think about the direction and where they could go, because they're dealing with young girls who are in underserved communities, who are experiencing things they need to know and they need to hear. Brittany understood that. She understood that message. And she said, you know what? Yes, I'll do it. So she came and she spoke to HRI. She talked about the young ladies. She also talked about, incorporating a recovery piece in there, a substance use piece, mental health piece. And now we're talking further, where she's like, I asked her, have you ever thought about, putting that into your curriculum? And she said, that's something that we really do need to think about. So now it's a discussion. We've opened that discussion. And also in talking to her about HRI and her coming to speak to HRI after the event, all of the food that was ordered and all of the food that was left over, guess where it went? It went to 2 recovery houses because of that conversation and because of that partnership that we created. So it's not always monetary. It's about the resources that somebody else has, and they can help you. So an unconventional partnership that can lead to further. It puts our name out there. We're visible. We're in the room. Our name is in the room. And now we can depend on her to, yes, it's about the food. It's about the food. But it was great for her to see that connection and see how that could work. And then to also at the end of that to say, hey, now I know what you do. I know some of the hardships. So the resources that we have, then now let's put that back into you guys. So that was a beautiful relationship that's going to continue. I sit on the board for an organization called the Party Sober Partnership. We are a group of 14 organizations in the recovery community. So yes, it's partnerships that you would think that would happen, but the relationships that come out of that, of being involved in that organization, it's 14 organizations coming together. Can you imagine the resources that are in there? The networking that's in there? That HRI can't do it by themselves, but knowing that I have 13 other organizations that when I need something, we can all do it together. So we're putting on all of these events together. We couldn't do it alone, but with these 14 organizations, we can do it. So that's a beautiful partnership. The Houston Texans, guys, we are partners with the Houston Texans. So last year, the Houston Texans reached out to us and said that they were interested in having a recovery game day. And we said, really? Okay. And it was first, it went through Mr. Leonard Kincaid with the Houston Recovery Center. Mr. Kincaid, who is the chair for HRI, realized that HRI can do more with this than the Houston Recovery Center could because of our reach. We have, how many people, Kristen? We have over 900 people on our listserv.
Mhm.
So he realized that we can do more with this information, and we did. We ran with it. I took it to Party Sober Partnership, again, with those 14 organizations. We planned it. It was a recovery game day, and we sold over 800 tickets, and we were all sitting together at the Houston Texans game. We had a tailgate. Again, another partnership, 𝐏𝐫𝐞𝐬𝐿. 𝐏𝐫𝐞 forever supports us. Anything that we need when we're having an event, we go to them and they give us money. And we love it. So don't be afraid to write to the CEOs or whoever of the companies and ask for it. Even if it's you can't donate this, you can't donate any money, but hey, we need hot dog buns. Can you give us some hot dog buns? Can you give us sodas? Can you give us, anything? Don't be afraid to ask that. We wrote letters we had letters already ready. We have, it's already on letterhead. It's already ready to go out. And we're going to take it to anybody that we think. And we took it to Sam's Club. Sam's Club gave us money and helps us now every year. We have a chili cook-off every year. Sam's Club helps us every year. 𝐏𝐫𝐵. but with the Houston Texans Recovery Game Day, we were able to have a tailgate for people who normally would not be able to attend a tailgate. We were able to go, we had a photo op. At the end of the game, we got to go onto the field and take photos. So it was beautiful. And guess what? This year they're ready again. They came to us again and say, hey, we want this to be an annual thing. So now we're in preparation again for our second Houston Texans Recovery Game Day. So that's a partnership that Houston Texans they create a flyer for us. They put it out there, create a link for us, Biggest Day, Recovery Day, HRI, part of Parties of a Partnership. We get all this publicity from this. And so putting your name out there and creating these relationships. Kristen has something out there with Live in Balance, meditation and journaling too. That's a one person organization who's in the community, who's doing these things that we are now going to partner with, that's going to go speak to women's homes, ladies in recovery that need these types of services. So again, unconventional partnerships. On one of our grants, we have our sector leads, fraternities, sororities, all of these that put your name out there in places that you would normally not, your name would not be heard, your name would not be in that room. So these unconventional partnerships, relationships are big. Don't be afraid to step outside of what you normally see, where you normally see yourself, and reach out to these other organizations. There's somewhere for you. You have to be very creative. Knowing what you do and what you bring to the table. Like Kristen was saying with your elevator pitch, when somebody asks you, you should be, should be able to spit it off. I know who I am. I know what we do. And I know exactly where I can fit in, and I know exactly where I can help you. That's all I got for unconventional organizations. Thank you, Janet.
Okay. Thank you. So avoiding duplication of services. So this is not me saying, well, McDonald's is in my community, so I don't need to worry about food, or because as we have talked about, food is a theme in all relationships, right? What I'm talking about is when you are looking to partner with an organization, you don't need to start an employment training system because they have it, right? If they are filling the gap for the community and they're doing a good job, that's great. If you know that there are services in your community and they're not that great, then by all means feel free to offer those within your nonprofit. So duplication in general is when multiple organizations offer similar services in the same community. So I live in it's called the Goof, which is kind of cool. All my Houston peeps, when I where I used to live was called the Vintage, and I was like, oh, that's really elitist and pretentious. I don't know that I should live there. So I did move. Now I live in the Goof. If you're familiar with the Heights, it's immediately north of 610. It's a different vibe. But we'll say in my neck of the woods, if everybody is providing employment services, but nobody's providing treatment, well, then there's a treatment gap in my community. Is that something I'm interested in providing? Is that something I'm interested in as an employment provider, finding a treatment provider in another community to come in and help me start that service, right? We would be partnering. If there's another organization in the same community that has similar services but not exactly the same, can we partner so that we can maximize our resources, so that we can not not compete for grants, but co-apply for grants. Those do really well. When it comes to the world of policy, it's really important to not be the only person in the room that thinks the way that you do. You need to find other organizations, even if they're across the state of Texas, that say, hey, if we made this change, it would improve these outcomes, and this is the data that we bring to back up our opinion. I personally, I feel intimidated. I shouldn't, but I feel intimidated if there's a bill trying to be passed and I'm asked to go speak because I'm going, yes, I'm going as head of an organization, but I'm going there as an individual. Technically, when they invite people from the community, from an organization, from an academic institution, they're there in pairs, they're there as a group. So I want to be able to bring with me a bunch of like-minded people so that we can talk about, hey, we see this gap in our community, or we would like to increase access to this service so that we can increase delivery, just like Jesse was talking about at the beginning. So Medicaid billing for peer support services, like that's huge. You know, it's so hard for some organizations to employ peers and pay them a livable wage if they don't have a way to reimburse for their time, right? Same with pharmacists, same with any other than physicians, same with all these other healthcare professionals other than physicians. There's always a physician rate for whatever reason, and then everybody else gets a small percentage of that rate. If you can bring voices together, then strong voices, then you can help improve policy changes at the state and the national level. When we do duplicate services, which can sometimes happen, it can lead to inefficiencies in service delivery. It can lead to wasted resources, and it can lead to gaps for those that need those services, and they can end up being really frustrated. We know the healthcare system is incredibly fragmented. It is ridiculously expensive for people that don't have health insurance, and Texas has the highest number of uninsured in the country, right? So there's a lot of organizations, healthcare wise, that do duplication of services because they're trying to get reimbursed any way they can. But for the patients, they're inefficient systems. They're wasting the resources of not just the patient, right, with taking a day off work, paying to drive there, or paying somebody else to drive them there, doing an Uber, whatever it is. But then they're also falling into the gaps when they run out of that funding. So that is when we talked before about trying to size up your potential partner and see how you two fit together. That's definitely a conversation that you need to have, is where do we see possible duplication? Is it going to lead to wasted resources for either of us, and are people going to fall through the gap? One other thing that I tend to ask people when we do presentations, like, what is your why? Like, why are you in this room? If you know that you're never, you're not going to make $1 million in the nonprofit world, and we're not going to end world hunger. Like, why would you want to work in the nonprofit space, right? And it's because I don't want people to fall through the gaps that I fell through, right? And there's even worse gaps than what I went into. I want to protect those individuals, but at the same time, I need to protect those organizations that are working to help them. And that has to start with me having honest, transparent conversations with my potential partners, and trying to assess where the duplication is happening, and to see if either of us or both of us can make some changes. And as I mentioned before, there's a financial burden to both the client and the organization. If you're spending a lot of time, money, or resources into a program that is being duplicated by another organization, typically neither organization is going to, it's kind of like when you're selling your home and they're like, well, if you renovate your bathroom, you're going to get like 40% of it back. It's like, that doesn't seem great. But clients also deserve to have the opportunity to pursue multiple options, right? If they didn't like a provider or they didn't like an organization. In most other sectors, competition can drive for better outcomes. That's not to say that it can't happen in the nonprofit space, but it's certainly something that we need to talk about. I will say this: if you're duplicating services and spending money that you're not recouping, then those funds are not being available to serve underserved areas or start new or innovative programs. And it can be, that's why there's typically such a big change in perspective between people that are boots on the ground, people that are, mid-level management, and then the upper C-suite, right? The upper leadership, because everybody has a different perspective of, what's important. And it's important to get those individuals together to talk about, one, what are the needs of the individuals in the community, but then also I'm sorry, I just lost my train of thought. What are the needs of the individuals of the community? And then also what is going to make the nonprofit organization sustainable, right? Going back to the emotional toll of the clients, again, if they have disconnected or overlapping services, they're going to be bummed out. But also imagine if there's duplication of services in organizations, employees and volunteers get burned out too. The number one most costly loss that any organization can face, as Janet will tell you, is when you have an employee leave to go somewhere else, right? Because now it's going to take 2 years to train that person that replaces them, right? You don't want to burn out your employees. You don't want your volunteers to leave. You want them to be able to stay and continue the fight. So you don't want to have duplication that way. And I saw Jessie popped up. I want to make sure she doesn't have anything to say.
Yeah, I just wanted to give an example. When I was with NAPS, I was, if y'all weren't aware, I was the board president when I left, and we ended up in a couple of different partnerships that were really strategic, and they sometimes looked very similar. One of them was we partnered with the New York Association of Psych Rehab Services. They went by NIAPRS, and now they changed their name to the Alliance for Rights and Recovery. And we partnered with them because they had a great system internally for staffing, and they were able to hire people on and provide them better support than we could when we were just barely getting started and being able to employ people again. And they were able to provide us with support. Technically, we were both membership organizations. They had a national reach, we had a national reach. We're both in peer areas, even though their name was outdated for what they did. At that point, we were both in peer areas, but they focused their membership and a lot of their efforts on New York, and they wanted to support our national efforts. We were national in our membership, and we wanted to support them in their growth. And so we were able to create a really great partnership there. Well, yeah, technically some of it was the same, but in our partnership, we were able to avoid that duplication. Another example is when we partnered with Mental Health America. They had amazing folks available to do advocacy at the national level, but they had only a few folks that were actually peer supporters. and we were all peer supporters. And so we were able to work with them on helping to clarify different ways of talking about things and different advocacy points. And they were able to actually get people in front of the folks that needed to be advocated to. And so there's so many different ways that you can look at partnerships with organizations that are similar in different ways, but without duplicating.
Fantastic. Thank you for those examples. That was great. Anybody else have a question or anything? So the next topic is aligning your risk, aligning your purpose with risk. Because if I sit in a room all by myself and give presentations to myself, like, I'm aligned with my purpose 100%, and I'm not risking anything, right? So who am I helping if that's all I do, right? So that's a very extreme example, but I want you to be able to visualize, like, you have a purpose and there are things you have to, you know, that you need to do. And then there are things that you need to do that are risky, and then kind of continuing along the spectrum. And then, you know, some getting to a point where I tend to think about financial riskiness. There, you know, because we deal with data that comes straight from several government agencies. I can't be too outspoken about certain things. But the reality is, you know, I can be truthful about the data that I share, right? And I have to figure out how to walk both of those lines, right? Who is familiar with what the fourth wave is? Nobody? Okay, let me ask this. Who knows why we started paying attention to the opioid crisis to begin with? Well, Mike does. You're making that face like I know what it is, but I don't want to say it.
All I can think is deaths and people started putting money to it.
So who started dying? I mean, you basically said it in that one sentence. People started dying that had money.
And they had money from lawsuits.
Right. So before when we had Black and brown communities dying, people weren't putting money to those fights, right? But then when you had people from affluent backgrounds starting to die, then we started seeing money come to those fights. Additionally, when we started getting funds from the opioid settlement lawsuits, then we started looking at certain populations, myself included, of, oh, well, you know, this individual was caught up in over prescribing and pharmacies were over dispensing, and it's, you know, they're a pain patient, it's not their fault. I hear that now, which empowers me to share my story, because when I was living that story, we did not think that yet, right? So we came full force, like we had Black and brown communities more likely statistically, right, using stimulants, poor white communities using stimulants, and then we had poor white communities started to use opiates, and then we had affluent white communities using opiates, and that's when we started paying attention to it and started putting money out.
College kids and college and high school kids started.
Yes.
And then
they
it was their
right.
Kids. It was their kids.
They mattered,
so
right?
Like, well, now it's a problem if it's in our household.
Now it's a problem. Exactly. The fourth wave is what we are entering now. We actually hit a milestone in February, in that people who smoke drugs are more likely to die of an overdose beginning February 2024 than any other community, right? Who is smoking drugs? Are going, again, it's Black and brown communities and poor white folks. Are we going to go back to not caring? Right? So when I have those, when I have to share that data, and obviously not for this presentation, but when I'm sharing that data and I'm sharing data from multiple health departments and I'm showing like how much money is being spent on the treatment roles versus the punitive roles, like how many are we arresting out of this, drug epidemic, like, does that really work? Like there's ways of sharing that information and being inflammatory, and then there's ways of not, and it kind of depends on who I'm talking to, but my organizational purpose is the same each time. So I have to determine, depending on what information I'm trying to share, how risky do I want to be with how I want to share it, because I don't want, I'm never truly trying to badmouth an organization that spends more money in one arena versus the other. Like, we know all of these things have to come together, right? And a certain percentage, and every community is different. Obviously, if they're sharing data with me, it's because they want to make change, right? And I don't want to ever share the message that they're intentionally harming folks by what they're doing if I know that they're trying to make change by sharing the data with me. But every community is different, and I do get a lot of information from the state because some community agencies don't want to share data. So we'll just say that too. So if you're trying to determine where along that walkway you're going to walk, always start with what we did at the beginning. Who's my organization? What's my elevator pitch for me? And then what is my mission statement, or what are my core goals? What are the things that identify me as a nonprofit organization? And then think about where those core purpose, those mission and values align with what's happening in the community, what's happening in Texas. How does Houston compare to El Paso? Like, what connections do I want to bring together? And then identify the risks and opportunity by sharing certain data, by speaking for certain groups, and I mentioned it earlier, like I used to work in harm reduction, or I worked in recovery support services. It just depended on who I was talking to, right? That's a perfect example of that. Even if I know somebody is dead set against harm reduction, sometimes people will still give you money for food, right? They'll give you money to help with housing for somebody. They will give you money towards education. They will give you money to fund another program within your harm reduction portfolio that is not harm reduction, right? It just depends on how you present it. So don't ever feel like anything is cut and dry, because in Texas, in the recovery world, it is not. Just try to identify who you're talking to and what the opportunities are and how you want to present things. Align strategies with the gaps that are not being met, the people that are being underserved. And I always tell you the individuals that are going to be harmed if there's not a connection in strategies, or a connection between organizations. There's a video of a mom in Cypress, Texas, so it's just outside of Houston, and she had Ring cameras all over her house, and it records the moment that she found her 14-year-old son dead of an overdose. And it's just, it's heart-wrenching. I every time I watch that video, I remember, like, she goes downstairs and she changes clothes, right? Because in her mind, she knows he's dead and all these people are about to come over, because she was just in her pajamas. She was, just waking him up for school. And I remember being in that situation where something terrible had just happened, and my brain was like, if you just get dressed, it'll be okay. Like, you could handle this a little bit better. Like, I remember that moment, and whenever I, you know, show that video to people, I focus on that because that's something that I've been through. And if that video doesn't reach people, then they're completely heartless. But anyway, but I can reach them still, right? Because I'm in the room with them and I can talk about it. Also, you know, there are some people that I'm gonna get choked up talking about this, but there are some people that, you know, they're just going to dismiss it, you know, not my community, it would never happen to my kid. It's just such a, you know, far-reaching event for them, there's no way that would ever happen, and dismiss it, right, as a self-protection mechanism. And the whole time that all of this is happening, the dog is guarding the boy's room, right? The police are coming in, the medical examiner is coming in, and the family dog is there watching. That pulls the heartstrings of people like you would not believe. So you just have to figure out within your own story, within your organization, how you want to tell that story, and how you want to align your purpose with the possible risks that you might have. Jesse said we have 15 minutes left, so I might talk a little bit faster through this because I want to make sure that we get through 2 questions. So how do you align with partners that don't want you to do all the work? I typically align with people and then I feel like I have to do all the work. That's not sustainable for either organization for a really long period of time. So you want to make sure that you have a clear discussion of when you are meeting with people or other organizations, what is it that you need? What is it that I need? How can I do that for you? And then if there's a true barrier to meeting, you know, to not fulfilling the partnership as discussed, be honest about it. Say, you know, that is a really good idea for a program that we have right now, but it's about to run out of funding, and I don't know how long we're going to continue that. Don't just say, oh yeah, I can do that for you, and then not follow through, right? And then it, you know, can make your organization or just you as an individual look bad. If that does happen, be honest, establish open communication, just say, hey, you know, I thought that we were able to continue this program longer. We weren't able to do it. I sincerely apologize. Apologies are so underused in today's culture. I would highly encourage you to be honest and open from the start. And then as things progress, give an honest feedback about what's progressing. And then also, did their needs change? You know, in order to be mutually responsible as you both grow as organizations. Make sure that, sorry, I clicked on my button. Make sure that when you have a partner or when you're networking, break everything down into defined roles so that each organization or each individual has a say in the relationship and the partnership, and then be flexible because we're all human beings. You know, if we work in the recovery world, we all, you know, have a unique background. If you are flexible professionally, if you're flexible personally, be flexible professionally, because especially in Texas, we need individuals who can adapt to culture changes, can adapt to changes in the political scene, can focus on the mission, which is connecting with people and saving lives, right? And when I talk about my why of why I do this. It's because I almost died to get to this moment, right? I want to be able to continue fighting the good fight, and being able to help others continue on that path. So navigating boundaries, this is more of a personal issue sometimes, but also can apply to organizations. And I'll use HRI for an example. We've had a very successful adolescent work group in HRI since the beginning. But we were not actively incorporating drug prevention as part of our activities. And we went and applied for a grant that was to focus on youth and drug use prevention. And we ended up getting the grant. And so all of a sudden it's like, oh, wow, like, how are we going to do this, right? We have not done it by, okay, using all this money, we're just gonna like show up at elementary schools and we're gonna teach drug prevention. Like, that's not how it works. We partnered with organizations that were already in the community, that were already doing the work. So organizations, so this comes from the Partnership for Drug-Free Communities grant. Earlier, we partnered with an organization that was already doing education to schools, to churches, and to parents, both English and Spanish, in the neighborhoods that we wanted to do. Party Sober Partnership was already involved with us, but they have a recurring chili cook-off there that is open to people, kids and families. Again, food is like the top secret ingredient, I promise. I would also say that our power was always connecting the people that were doing the work in the treatment world to the outside resources, like law enforcement, like government agencies, like first responder agencies. A parents group may not feel comfortable approaching those organizations, but we did. And so we can be the go-between between those organizations. So we've had to learn in new ways, but we solidified our partnerships with different organizations after getting that grant, and it's been really helpful. I would say that one way that you can keep from having mission creep, meaning you change your mission every time there's a new grant, is have funding sources from a variety of sources. Our first grant was from Health and Human Services. The second grant, the one I was just talking about, was focused on youth drug prevention. The third grant was on behavioral health integration and collecting data, looking at overdose data, and trying to increase prevention and outreach opportunities in the community. That really helps you stick to your mission. If you are continually, looking at funding sources, but also what is it definitely, how does it relate to my organization, and am I going to be able to fulfill the obligations of this grant and stay true to the organization? Communicate your boundaries to your employees, to your staff, educate them, communicate them to your partners and potential partners. There's certain types of treatment that I know are medically not successful long term. I don't, especially as a pharmacist or a patient, I've been approached to push those, and I haven't done that. Now, I'm not negatively bashing companies or organizations, but I'm not going to say that something works when I know that it doesn't, right? And then always seek allies and advocates that are doing the work that you're doing. Take classes like this, go to all the meetings, eat all the food. It's really interesting how much money is thrown out for food. And make sure you have a business card, even if you have to make it for yourself. It gives people your contact information. Even if it's just your LinkedIn account, create a LinkedIn account. Find people that are in your area, in your community, that are doing the same work that you do, and you'll never be alone. And Regina, do you have any closing thoughts?
No, I think you summed it up.
Okay. Okay. Any questions from anybody? I liked how she put at another job.
I wanted to say this was an excellent presentation. I'm already excited.
Oh, good.
Oh, that's great, Janet.
Yes, and I will say, I believe there's a contact slide. Oh, just real quick, remember why you need to network and why you want to stay open-minded and always stay humble. And then this is our contact information. You are always welcome to email me. I highly suggest you email Regina at the same time because she is much more responsive with her email than I am.
Jesse, I want to respond to you. The business card, you know, with this new age, again, technology, it's so awesome. You can do whatever you want, you know. Like I created a QR code, you know, on my phone. So now I just, hey, scan this, yeah.
Oh yeah, you can do that on your phone.
Yeah, you can do it on your phone. It's called Blink. You just create your own and just say scan this. So yeah, there's so many ways around everything. But thank you guys so much for coming. We're honored.
And thank you both for being here and sharing your knowledge and wisdom and being willing to share your contact information as well. I will say that with the next one, we have a different presenter, which is a more national view and is also working with SAMHSA right now on helping to plan ROSC 2.0. And so that's going to be really exciting. I don't know how much she's going to talk about that, but we have Amy Brinkley scheduled to come in. And if you haven't heard who she is, she's somebody who works with the NOAA Abdenauers of all the states in the US, quite literally. And she has partnerships at SAMHSA, she has partnerships in other organizations, and she's going to be coming to build off of what Kristen and Regina have given us. And so that way you get a local and state perspective, and then you also get a national perspective. So it's not necessarily 101, 201, it's more local and national, but I'm really excited for all of this. So make sure you're not missing the next one.